A 14-year-old girl awakens with a mild sore throat, low-grade fever, and a diffuse maculopapular rash. During the next 24 hours, she develops tender swelling of her wrists and redness of her eyes. In addition, her physician notes mild tenderness and marked swelling of her posterior cervical and occipital lymph nodes. 4 days after the onset of her illness, the rash has vanished. Which of the following is the most likely diagnosis? Welcome back, viewers. Today we have an intriguing case to solve involving a 14-year-old girl presenting with several symptoms. Together, let's analyze the clues to find the most likely diagnosis. Our patient's symptoms include a mild sore throat, a low-grade fever, and a diffuse maculopapular rash. The key to solving this puzzle lies in the progression of her symptoms over the next 24 hours. Roseola, also known as Erythema Infectiosum, typically begins with a high fever that lasts for a few days and is followed by an appearance of a rash once the fever subsides. Since our patient's fever is mild and the rash appears before the fever peaks, we can confidently rule out Roseola. Now, let's examine the symptoms that develop within the next 24 hours. Tender swelling of the wrists and redness of the eyes, along with the marked swelling of the posterior cervical and occipital lymph nodes. Erythema Infectiosum, also known as fifth disease, typically presents with a slapped cheek appearance and a lacy rash on the extremities. The symptoms described by our patient do not match the characteristic features of Erythema Infectiosum. Now, let's focus on the remaining possibilities: Rubella, Rubeola, and Erythema Multiforme. Rubeola, commonly known as measles, is characterized by the 3 C's: cough, coryza, and conjunctivitis. Although our patient has redness of the eyes, she doesn't exhibit the other typical symptoms of measles. This leaves us with 2 options: Rubella and Erythema Multiforme. Erythema Multiforme is an immune-mediated skin condition that can be triggered by infections, medications, or other factors. However, in this case, the symptoms of tender wrist swelling, red eyes, and marked cervical lymph node involvement do not align with the characteristic presentation of Erythema Multiforme. After carefully considering all the clues, the most likely diagnosis in this case is Rubella, also known as German measles. Rubella typically presents with a mild sore throat, low-grade fever, a maculopapular rash, and lymphadenopathy. The progression of symptoms, including the disappearance of the rash after 4 days, further supports this diagnosis.